If your LDL is high, you better put them on a statin. If your HDL is low, you need to put them on a statin. If your total cholesterol is high, you need to put them on a statin. That's really the general consensus among most medical doctors, and don't really go more in detail because there's a lot of patients that could have totally normal LDLs or HDLs or total cholesterols, or maybe their total cholesterol is elevated, but they have way awesome HDLs or way low and good LDLs, but they have all these other factors that we want to look at that are really healthy. So it's very important to really get dialed in detailed labs so you can really prevent heart attack, stroke, keep your blood vessels healthy so you have a lot of energy, focus, concentration, because your blood vessels is what keeps you healthy. If your blood vessels aren't healthy, you're not going to get good oxygen, you're not going to get nutrients throughout your entire body. Welcome back to The Root Cause with Dr. Jake. I'm Dr. Jake Schmutz. I'm a naturopathic medical doctor and integrative physician. On this channel, I have real conversations with real patients to show you how to heal your body down to the root causes without any harmful drugs or surgeries. I'm here today with my co-host and patient, Teresa Marie, to talk about integrative labs for cardiovascular assessment. This goes well beyond what your basic medical doctor will be doing. We're going to talk about cardiovascular age, heart attack risk, and more.
Dr. Jake, so good to see you again this week. It's a pleasure to be here and be able to, just ask all the questions and really learn from you when it comes to cardiovascular health. We've done a few different episodes already in the past when it comes to cardiovascular age. We've talked about some of the, markers that people can be using from their aura rings and things like that to keep track of it. And on a prior episode, you had mentioned that you run labs a bit differently than the standard doctor. And you kind of explained a little bit about what the approach is for most doctors and why they don't do this. But I'd love to jump back and kind of review that before we start getting into the labs that you recommend. So what is it? Why don't doctors test for certain things? And what is the problem with these usual cardio labs that most standard doctors?
So yeah, let's talk about why do doctors not go in much detail as I do, and what are the basic labs, and why do we go further? So main reason why doctors don't really go into this is they learn this basic formula when they're in medical school. Okay, this person has a possible cardiovascular risk, or they're coming in and they want to prevent getting a heart attack. These are the basic labs that you order. If your LDL is high, you better put them on a statin. If your HDL is low, you need to put them on a statin. If your total cholesterol is high, you need to put them on a statin. That's really the general consensus among most medical doctors, and don't really go more in detail. This really doesn't look at things enough because there's a lot of patients that could have totally normal LDLs or HDLs or total cholesterols, or maybe their total cholesterol is elevated, but they have way awesome HDLs or way low and good LDLs, but they have all these other factors that we want to look at that are really healthy. So it's very important to really get dialed in detailed labs so you can really prevent heart attack, stroke, keep your blood vessels healthy so you have a lot of energy, focus, concentration, because your blood vessels is what keeps you healthy. If your blood vessels aren't healthy, you're not going to get good oxygen, you're not going to get nutrients throughout your entire body.
That makes a lot of sense because I think on a prior episode, way back, we've been doing this for some time. You had mentioned about, the benefits of cholesterol and how the cholesterol is actually there to help repair your veins. Where the problem can be is if your veins are swollen from damage and all sorts. And you've talked about it on those different episodes as well, too much sugar, inflammation, and things like that. That's when cholesterol becomes a danger because you've got these swollen veins. The cholesterol goes in there to go bind it up, and then now it's so swollen the cholesterol is now blocking, and then of course now you have that danger. And most doctors seem to approach, oh, okay, the problem must be the cholesterol, but you look at a bigger picture and say, okay, no, it may not. The cholesterol is one factor, but let's look at the veins. What's happening with them? Are they swollen? Are they not? What can we do about it? So let's go through and talk about the list of labs that you recommend when you want to do a full workup on someone to not only see where they're at with their cardiovascular health, but also where they're at in that cardiovascular aging process and where are they at when it comes to risk for heart attack, et cetera. So I'm just going to take notes. I know our listeners will as well. And, I'll ask questions along the way. I'm really looking forward to hearing more about, each one of these labs and why you take what they measure, why you actually want to see these particular labs in the first place?
Yeah, so let's start with some of the basic labs. This is what your basic medical doctor is going to order when you go in. I do like to look at these. This is important. Your total cholesterol, your HDL, your LDL, your HDL total cholesterol ratio, LDL total cholesterol ratio, your VLDL. These are all important tests to really take a look at, but how I assess it is going to be quite a bit different than what your medical doctor might assess, because sometimes what they do is they just look at, okay, total cholesterol is at this number greater than 200. We need to do something about it. And then they forget about all of the other things, the HDL, LDL. So maybe you have a really high HDL, maybe it's in like the 60s or 70s, making your total high, but your LDL is actually below 120. And then your total might be at like 220, 230, something like that. That's actually very healthy. So you got to look at all the factors, put them all together to really come up with the appropriate assessment there. So that's the basic stuff. But I don't want to just stick there with the basic cholesterol labs because it doesn't give me enough information. I like to go further. I like to order what's called the apoprotein B test. This is a protein that holds the chylomicrons, which are cholesterol laden units. And then it also has LDLs, lipoproteins in there, holds all those. And what we see is you could have pretty LDL could be looking pretty good, but then possibly your apoprotein B is elevated. And then your cardiovascular risk greatly elevates with this apoprotein B. And most doctors don't order this, even though there's extensive research on this. So it's very important to take a look at your apoprotein B to see if your cardiovascular rate age is actually good. So if you have an elevated apoprotein B, your cardiovascular age isn't doing very good. Even if your HRV and your PWV or your cardiovascular age on your Oura Ring or Apple Watch or whatever assessment tool you have is looking good, if your apoprotein B is high, that's going to increase your risk, cardiovascular risk.
Question
Mhm.
about the ApoB before you jump into the other labs. Isn't there like a genetic, there's a gene out there that I've heard that can put people at risk for this particular lab to be increased and to have a risk for cardiovascular. I've heard of this gene. It's like it's an APO something. Is that related to this lab?
Good question, Peace. I was just going to talk about that when you
I
interrupted me right
interrupted
there.
you?
This is called lipoprotein A. So it's a lipoprotein, but it's more of a genetic piece because you could be living a really healthy life. You could be exercising great. You're eating a really great diet. You're really dialed in. You're actually eating like a vegan diet. You're not getting any cholesterol at all or any fat or anything like that getting in there. So why would you have an issue? But you have an elevated lipoprotein A. And that is a protein that binds to these holds LDLs and chylomicrons, et cetera. And that greatly elevates your cardiovascular risks too. So, very important thing. I always like to check a lipoprotein A because everything could be looking pretty good, but then you have an elevated lipoprotein A, and that's more genetic. And there are things that we can do to help decrease the lipoprotein A. So, we definitely want to identify that.
Yeah, and maybe that's something that we can talk about after we talk about these labs, or we can go into more depth, even so on future episodes. So really looking forward to that. I know that this is becoming, it's more and more people are becoming aware of this particular genetic predisposition that can put them at risk for heart attack and so forth. So after you measure their apoprotein B, your apoprotein A, what are some of the other labs that you like to look at to give a full assessment of somebody's cardiovascular health?
Yeah, some other labs I like to look at is you want to look at particle size. So you could have an LDL, which just tells us all the sizes of LDL, but we want to look at the particle size because the bigger the particles, the more risk you have of it implanting in your blood vessel and causing an issue. So we want to make sure that they aren't too small and entering in there and causing an issue. So we want to check that particle size is very important of your LDL. We also like to check the sizes of your HDL and to see, make sure that that is big. So we want your HDL to be big because that means it's filled with a lot of uh, cholesterol that is going to be eliminated. We want your LDL size to be small because that means it doesn't have a ton of bad cholesterol in there that's going to implant in your blood vessels. But also we want to look at the number of particles too, because that makes a big problem too. If you have way too many particles, you have a greater risk of actually implanting in the blood vessel in that way also. So that's the cholesterol labs, much more detailed look at that of what is going on with your cholesterol besides just the basic stuff. So this really gives us a real good look at what is your cardiovascular age, because you're not going to know it very well if you just do the basic labs. You need to be looking at the lipoprotein A, the ApoB, the particle size, the particle numbers, etc., to really get a good idea. But we're just talking about cholesterol.
Yes. And question about that before we jump on past cholesterol. You had mentioned earlier that, a standard workup, they're going to measure your LDL and your HDL. And if any of the numbers are high, they put you on a statin. Now, here you are, and you're talking about, whoa, well, let's see if the apoprotein is elevated. Let's see if the apoprotein A is. Let's look at particle size. What if the HDL is big? What if the LDL is small? Is there a downside if someone were to not do this and instead go to a standard doctor? They see that their HDL and their LDL is high, or it's whatever ratio that the doctor is like, oh, this is high, let's put them on a statin. Is there negative effects of getting on a statin when, let's say, instead the particle LDL size is actually small and their HDL is actually big? And so,
Yep.
and the number of the actual particles are actually not significant. Is there damage in getting these statins?
Yeah. So if you're taking a statin when you don't absolutely need it, you're going to decrease your cholesterol too much. And we need cholesterol for our brain to work effectively, for our hormones to work effectively, et cetera. Most of our brain is made up of cholesterol. So we definitely don't want to be taking a statin when we don't need it. I'm not a huge statin fan anyways. Some cases, some patients do need statins. Their cholesterol's out of control and all these other things aren't really working. But majority of the case, you don't absolutely need it. But yeah, if you're getting on a statin and your particle number is low and your HDL is high, size is high and your LDL is low, yeah, it's a big problem for sure.
Okay, that I think is so key here, because I think a lot of people might be like, who cares? I'll just get on the statin, it'll solve the problem. And then no, we're learning you can actually cause more problems in your life. You can actually start having brain issues, hormone issues, if you get on a medication that you don't actually need. And so when you get the full workup of actual tests beyond just the standard cholesterol tests, you can actually discover whether or not you really do have an issue and whether or not you really do need to be on a statin, so that you can actually get your body to a healthy place, reduce your risk of cardiovascular problems, and not at the risk of losing your cognitive abilities, of hurting your hormone abilities, which are all essential to our health, right? Cardiovascular is a part of a much bigger puzzle. So we've talked about the cholesterol labs that you like to look at. What are some other labs that you look at to assess someone's cardiovascular health?
Yeah. So some other labs like to look at besides the cholesterol piece. This is just important, but it's just a piece, right? So I want to look at the inflammation of the blood vessel. So I want to see their highly sensitive CRP. That's different than just regular CRP. It's highly sensitive CRP. Regular just CRP looks at just general inflammation throughout your body, but highly sensitive CRP is more focused on our blood vessel inflammation. So that's very important. So your cholesterol could look good or maybe not great, but not horrible, but you have high C-reactive protein. That's going to increase the stickiness of the blood vessel for the cholesterol to actually bind to the blood vessel and form a plaque. So we want to make sure we check the inflammation, make sure that's not elevated, because if it's elevated, we need to take care of that. So let's say you're just taking a statin, not taking care of the inflammation. You're really not going to do a ton, because that little amount of cholesterol that you might be decreasing with the statin is still going to implant itself on the blood vessel. So very important. Another one I like to look at is sedimentation rate. This is a one that just checks for general inflammation. But when I see that elevated, I do see that there's increased cardiovascular risk in that case. Another one I want to look at is I want to make sure that their blood sugar is good. So I want to do a fasting blood sugar. I also want to do a hemoglobin A1C. This is what checks your blood sugar over a 3 to 4 month period of time. And I also want to make sure that the insulin is good. So I check 3 different things. to really make sure that their blood sugar is regulated appropriately. Because blood sugar is elevated, it is going to cause an inflammatory process in the blood vessel, which is then going to increase your cardiovascular risk of forming plaque or increase your risk of damaging your capillaries so you don't have good blood flow or circulation. So going back a little bit, we're talking a lot about heart attack and stroke. Okay, that's a big piece, but cardiovascular health is so much more than just having a heart attack or stroke. If your blood vessels or your heart is not delivering oxygen or nutrients throughout your body very well, it's like the little roads, right? So if we stop the trucks or the airplanes that deliver all of our stuff, right, we're not going to be living very long. So we need to make sure those roads are not clogged up and working appropriately. And that's our blood vessels. So if our blood vessels aren't working right, we're not going to get good oxygen. We're not going to get good nutrients, meaning our brain's not going to work well, meaning our kidneys aren't going to work well, our GI tract's not going to work well. Then we have poor, even further toxic load of formulation and also decreased nutrient absorption. And you can see what's going on here. And obviously you're going to have a lot of fatigue and brain fog too, right? When your blood vessels aren't working well. So it's very important just to make sure your cardiovascular health is good, even though aren't even worried about heart attack or stroke. Maybe you're just in your 40s, like, I'm not worried about a heart attack or stroke. I have nothing in my family of a heart attack or stroke. Still need to look at your cardiovascular health just to keep your body healthy in general. So that's a side tangent there.
It seems
Another
like
test.
it
Go ahead.
seems
Yes.
it seems like, you know, the blood sugar part here that you were referring to as it relates to everything could also be an indicator of like root cause issues to the swollen veins as well, right? Like if they are having a high hemoglobin A1C, high fasting blood sugar, that kind of a thing, wouldn't that suggest um, that it could be causing inflammation in the veins as part of, and that's like part of the reason why it is affecting the cardiovascular side?
Yeah. So it's causing inflammation of the arteries, the veins, the capillaries, etc. And that inflammatory response is going to decrease how many red blood cells are able to actually enter the tissue. And that's more regarding the capillaries. The capillaries are very microscopic. They're smaller than a red blood cell, and red blood cells have to already collapse a lot to get in there. So if they narrow more from more inflammation, like elevated blood sugar or other things that cause that, you're going to have decreased red blood cells to enter there because they're not able to collapse enough to go through that narrow capillary. So, and then you don't get a good oxygen, and oxygen is needed for your mitochondria to work, and mitochondria is what makes every cell work. So obviously your brain's not going to work well, your gut cell, kidneys, on and on and on, right? So
This
very
makes a
important.
lot of sense. And I think this is why doctors like you are so just important, I think, for people to be able to learn more about, because you tend to look at the whole body and recognizing that there's no one system that's a silo system that you just need to take care of, that there's often a relationship that each system has with others. And there's a domino effect that can happen, so that if one system's not working, it's going to affect another system, which is going to affect another system, and so forth. And so taking a look at some of these other labs that are outside of just a standard cardiovascular checkup really gives a good picture as to where you're in the spectrum of cardiovascular health. Yes, maybe you're not right now at risk for a heart attack today, but maybe with the where you're at on the spectrum, you're at risk later, and you can be able to nip things in the bud earlier to prevent that, and obviously have a longer, healthier life. So I love this. We've talked about cholesterol. We've talked about inflammation markers like CRP. We've talked about sedimentation rate. We've looked at other labs that are outside of just standard cardiovascular, like blood sugar and hemoglobin A1C. All of this kind of really, I think, plays more into the inflammation side. What else do you look at when it comes to labs to assess cardiovascular health?
So the thing I want to go to next is toxins. So a lot of times we don't think about the cardiovascular system with toxins, but it's extremely important. If you have a high toxic load, you're going to have more inflammation in your blood vessels, which is then going to make your blood vessels more sticky, which is then going to cause cholesterol to stick to it. And then you're going to have plaque formation and get a heart attack or stroke in the future. So it's a huge, huge thing. We need to make sure that we look at environmental toxins. So we do like EnviroTox panel. Also important to make sure that we are checking even mold. So looking for mycotoxins, because you could have mold circulating in there. You don't have any symptoms at all. everything's going good, right? A lot of cardiovascular systems, you don't necessarily have symptoms, or maybe you do, you just don't think it's related to anything. You might not just feel great, but you don't know what it is. But it causes inflammation of the blood vessel, and that's going to lead to all kinds of health issues too. So when you look at all these possible toxins that could be damaging our blood vessel, causing inflammation, that leads me to my next component. And probably my favorite thing of all is actually checking the health of the glycocalyx. Probably a lot of you haven't heard of this, or maybe you've listened to one of my videos and you've learned about the glycocalyx of how important it is. And I don't know why a lot of doctors aren't talking about this, or a lot of cardiologists are talking about this, because it's been around a long time, but sometimes it takes a while for people to start talking about some really important things. So the glycocalyx, just to review, it is the mucus gel-like substance on the inside of our blood vessels, like our arteries, our veins, our capillaries. The endotheliums are right outside there. And that's the protection. It's the armor that protects it, right? So if you take away the armor, that's going to be a big problem, right? Now your blood vessel is going to get damaged from all kinds of stuff. The toxins that we talked about, the cholesterol is going to get in there, maybe chronic infections, etc., are going to be able to get into the blood vessel very effectively, cause that inflammation, cause that damage. And then, like Teresa was talking about, cholesterol is going to go there to heal it, which is good. It heals it. But we don't want our blood vessels to get healed, because that forms the plaque. And then the plaque could keep on building until it blocks. And then we have a heart attack or stroke, or it blocks blood flow to a toe. And now you have gangrene or whatever. So a lot of things can happen from just the glycocalyx being damaged. And that glycocalyx is then in our capillaries. Remember, the capillaries are really small, microscopic. So any type of little bit of damage to a capillary just causes it to block up, and it just is totally gone. And now you don't have the oxygen or nutrients get inside your tissues, your brain, your gut, your kidneys, etc.
I kind of think of it as this, like cholesterol is going to be like maybe like the cast for a broken bone. Great. Glad we have casts. It's a wonderful thing that we have that technology so that we can heal broken bones. But do we want to run around and be like, I'll just jump off this tree. I'll just go do this other thing because I'll just get a cast. I'll just get a cast. No big deal. It's like, let's minimize breaking the bones, right? So it's like the glycocalyx is, yes, we got cholesterol is a good thing. It can repair veins. However, if your veins are so messed that cholesterol needs to be there in the first place, like there's a problem. Let's solve why your veins are needing to be healed in the first place. So it's not like we don't want to heal them. We want to minimize needing to heal them so that you're not putting yourself at risk for a heart attack or a clot or things like that. Dr. Jake, this is, fascinating here. So we have cholesterol labs that we want to be tested for. We want to get our inflammation markers checked as well, which you listed out. We want to be able to look at our toxins, because toxins can get into the veins as well and cause swelling. So it's not just inflammation caused by blood sugar that could be the issue. It could be through toxins. You mentioned in another episode, like on gut health, same idea. This glycocalyx kind of acts as, it's like the lining of our gut. We have that, and toxins can get in if there's holes in our gut. Same thing with our veins. If our glycocalyx is struggling, we're going to have little cracks and things like that that's on our veins that are going to have these toxins come in, and then it's a vicious cycle. It's going to cause more inflammation, more problems, and so forth. Is there any other labs or any other things that you want to mention to our listeners here as to what you do when it comes to assessing cardiovascular health and why?
Yeah. So one other thing that I wanted to talk about is, and a lot of people don't think about this, is vitamin D. Also, and vitamin D and also our calcium, the balance between that. So we don't want to have too little vitamin D, because that's going to cause some breakdown of our bones, which then we're going to have calcium circulating around. And then that's going to form into our blood vessels, into that plaque that's forming. Calcium gets in there, hardens up, and causes an issue. So we want to make sure that's not an issue. So we want to make sure our vitamin D is at a good state because of good calcium metabolism. But also we want to make sure our inflammation is under control, because vitamin D is one of our hormones. We call it a vitamin, but it's really a hormone. It is our main hormone to keep our immune system in check. So if our vitamin D is too low, it's not going to keep our immune system in check. And then there's going to be inflammation is going to be able to go rampant and cause damage to our blood vessels. So vitamin D is important to keep our calcium under control, but also to help our inflammation. And that's why and one other thing I want to put in here too, and this isn't necessarily testing, but if you're taking vitamin D, you want to make sure you're taking vitamin K, because if you take vitamin D without K, you could possibly make your calcium levels go a little too high. And then that's a problem, right? So, but by vitamin K helps actually get that calcium inside our bones more readily. So it doesn't go to our blood vessels, it goes where it's supposed to be.
Interesting. So you're basically saying that some people who think they're being good, because we've all been told you got to supplement your vitamin D because you're not getting enough sunshine because we work inside jobs now and all of that, they're popping all this vitamin D. And if they're not taking enough K to go along with it, they're actually messing up their ratios and actually could be putting themselves at risk for cardiovascular problems.
Yeah. Yeah.
Well, Dr. Jake, I think that you've more than proven how what an expert you are in this, and why so many of us need to go in and get a checkup. How often do you think most people, just regular everyday persons, should get a full cardiovascular workup? And then for somebody who already has maybe some markers that are a little concerning, maybe they went to a standard doctor, saw that they had an LDL issue or an HDL issue, how often should they be getting checked?
Yeah. So someone that really doesn't have any symptoms, but just wants to be healthy and over 40 and older, I would recommend getting your labs and all the other tests that we talked about tested once a year. If you're younger than that and you don't have any symptoms, it's not as important. But if you start having some fatigue or brain fog, or you're not able to work out as well, it definitely could be related to your blood vessels because you're not getting enough oxygen or nutrients. So you need to get your cardiovascular labs checked because of that. Especially if you actually starting to get older and you're starting to get into your 50s and 60s, you should get this at least every year. But if we actually find something that we are treating, we're going to be checking your labs every 36 months to dial things in. And then after that, we're probably checking it every year or so at that point.
All right. Well, thank you so much, Dr. Jake, for your expertise today. And for our listeners who want to get a hold of Dr. Jake, you can click the link below. We have that in the show notes as well as the description box if you're watching this on YouTube. It's drjakewellness.com/schedule. Or you can give him a call at 801-938-7960.
Yes. And you want to learn more about cardiovascular aging and you're watching YouTube, click my video to the right. I'm Dr. Jake, and I'll see you there.